contributing factors. Diabetes is one of the first things that come to mind when you think of an unhealing wound, and that does tend to be a big consideration medically. People that are diabetic just have a harder time getting things to heal up. The way it affects their body, with the diabetes, you have problems with the circulation flow to wounds, and you don't have as good a circulation. And then a lot of times they will just spontaneously develop wounds. That's why when you look at feet, for example, which is always a huge consideration caring for a diabetic patient, that's one thing you want to check, because it can be something as simple as shoes that don't fit properly that can cause a place, and then before you know it, yeah, anything like that, and before you know it, it just kind of gets all blown out of proportion, and you have a huge wound to deal with, which kind of ties in with the fact that April is also Foot Awareness Month. I'm
usually aware of my feet most of the time, because sometimes they hurt a little bit.
They do. But one thing you'll talk to when you talk to people that are diabetic, it's very common, they'll tell you, my hands and my feet stay numb and tingly, and a lot of times...
Do they get cold?
It's like they have decreased sensations, what it is. And it's a decreased circulation and skin impairment. I just don't understand
why that is. Is it narrowing of arteries? Is it not getting pushed through there?
You're not getting the circulation, you're not getting what you need to keep those tissues healthy and intact. Yeah. And then you don't feel it, and that's the other part of it too, is they don't necessarily know that they've got a place. I've had
sometimes
patients,
pain is a good thing.
It can be, but they just don't know. I've had patients in the office, you take their shoes off and look at their feet, and they may have an ulcer on the bottom of their toe that, especially if you get somebody elderly or someone that has difficulty reaching their feet for whatever reasons, that they don't know. And then it's like, wow, how long has this been here? And they're like, well, I don't know. And it's just, it's things you want to pay really close attention to, in particular with diabetics. But there's also other things. You look at surgical wounds, things like that just may not heal appropriately for a variety of reasons. Whether it be the location on the body. I've had patients with wounds like on their elbows that don't heal well. It's an area you're moving all the time. They're not going to close up right. Just different things you have to consider.
And conveniently enough, we have somebody who knows a little bit about that.
We do. Today we have Dina Griffith with us, who is the director for the Holzer Wound Care Center in Jackson. And Dina, thank you so much for being our guest today.
Thank you for having me. I appreciate that. Yeah. Yes, as you said, April is Foot Awareness Month.
It is. Would you tell us a little bit about yourself and what, because I know you're not from our area, so can you tell us a little bit about what brought you to Jackson and how you ended up in this position?
Well, I have been away from the area for a long time. I have been in healthcare for the last 14 years. I started out my healthcare career at St. Mary's, believe it or not, in Huntington, West Virginia. And I traveled to Salt Lake City, Utah, and was out there at Salt Lake City Medical Center and Pioneer Valley and West Valley hospitals. Then I transferred over to Suffolk, Virginia, was in Suffolk, Virginia, then went up to Fort Wayne, Indiana, spent some time up in Fort Wayne, Indiana. Then I came down and managed 20 hospitals in the 2 states of Alabama and Mississippi. So a position came open up here in Jackson, Ohio, which I'm originally from, Ashland, Kentucky, born and raised there, but my career took me outside of the area, so it was a chance for us to come back and be with our family. And we said, okay, yeah, absolutely. Let's see if we can get this position. And I started the job here in Jackson in January. I actually am a graduate from Ohio University with 3 bachelor's degrees, one in healthcare administration, the other in long-term care administration, then a specialized studies bachelor degree in sociology and psychology, and also have a national certification in gerontology.
Wow, so you are very well educated in the healthcare field.
I feel like I'm well-rounded, and I can talk about just about anything, but when the job came available for the director's position at the Wound Care Center, I thought this is something that is, I'm very passionate about, helping people with their wounds and getting people the proper help that they need. A lot of people, well, in our area, we have a lot of diabetics in our area.
We do.
And at least 25% of that population will end up with a foot ulcer or an ulcer of some sort in their lifetime. That's a big, statistic. 25% of the diabetics here are going to end up with an ulcer. Well, we can treat those. We can help those people at the wound care center, no matter what the ulcer is, whether it's a diabetic ulcer or a wound from a spider bite or a surgical incision that just won't heal. We can help them at the wound care center. We have all different types of modalities. We have skin substitutes, skin grafts. We have hyperbaric oxygen therapy. So hyperbaric oxygen therapy, it helps to concentrate the oxygen into our plasma, and the plasma creates us new red blood cells, and red blood cells is what heals us. So, yeah.
It is, and that's a great option for the local community. With that, what type of patients do you feel that you see most, or is it mainly diabetics?
Well, we see a variety of different people that come into our office. We do see surgical patients that their wound doesn't heal. We do see a lot of diabetics. Probably the majority of our patients do have diabetes of some level of, either a A1C, that means your sugar is tested over time, and that's your number that you get. And we can get them as low as a 6 and as high as a 8 or a 10 or even more. And we help them heal their wounds. We have 100% healing rate.
That's a wonderful statistic.
Yes, it is 100%. I don't think you can get any better than that.
No, that's pretty good.
Yeah.
And I know a lot of times, and the reference you're talking about with the hemoglobin A1C, like a 6 to 8 and things, ideally you want to see your diabetic patients, you want to see them in the mid-6s at least.
Yes.
And what that means is that's a number over a 3-month period of time of where your sugar tends to stay. And so that gives you an average, and that tells you how well your diabetes is being controlled. The better your diabetes is controlled, the less likely you are to have problems with wound healing and other complications from diabetes. Now, I know on the practice end, out of my office in Jackson, it's a family practice. What I have done, I have sent actually several people to your facility, and they've all done really well. One thing you do, say for example, somebody comes in, they've got say you're talking about the spider bites, they've got a spider bite, and it tends to, those tend to get nasty fast, or a MRSA, which tends to get very ugly very fast too. Initially the first thing you do, if they're not too bad, you treat them in the office, go through a round of antibiotics, sometimes a second round. If it's not healing, it's like, okay, we need to get you somewhere where they can work on healing this wound. And a lot of these things have to heal from the inside out.
Yes.
So do you have to open it up and then let it go?
And a lot of times they'll open up themselves. But once and it's not something you want to mess around with. If you try reasonable
That's not a
factors,
home treatment. Let me get my pocket knife out.
People do all kinds of home treatments before they come to you. You'd be amazed at the things I've seen in wounds.
Yes.
But and a lot of times on the provider end, and what people want to know to do if you have a wound that's not healing is go see your primary care provider. Let them have a look at it, because you do need a referral to get to the.
Well, you can self-refer.
Oh, good.
You sure can. If they are at home and they haven't been to the doctor in a long time, and they have this chronic wound, they can come to our wound care center without a physician referral.
Good. You get people going, and we just make a nice little phone call.
Yes.
My secretary does, and gets them scheduled in with you guys, and then you take it from there. On my end of it, I really like it because I get progress reports. Say I send someone there, and every time that patient's seen, I'll get a nice, neat progress report that tells me how the patient's doing, how it's healing, what treatment options they're using. So it's kind of nice to be, you know how your patient's doing.
Absolutely.
But once we make that referral, they go to you guys. What's the process for a patient when they first come see you?
Well, they come in and we evaluate them. We have an interdisciplinary team of medical providers. We have physician doctors, we have clinical nurses, we have technicians, so we have a whole interdisciplinary team that come together, evaluate the patient, decide on what treatment that patient needs, and we go with that regimen. They usually come, if it's a wound, they'll come once a week, and we will see them. We'll measure the wound every time that they come to show that healing process of how it's shrinking down. And if it's hyperbaric therapy that they need, they come every day for that treatment. So we have a median heal rate of 27 days now. We can heal a wound in 27 days. It's amazing.
That is amazing.
Yeah.
It is. And now,
is there any prevention somebody can do? Say, I'm not, but if you're a diabetic, to keep these things from happening? Would it be massage or cleanliness, or is there something somebody can do or not?
I think there's a variety of things. Number one, you want to be aware of things. I always, you tell diabetic patients, examine your feet. Make sure you're wearing good shoes. This is not the time, especially you see it a lot in summer too. They're running around in flip-flops from the dollar store, and no, then you end up, with whatever in your foot.
You're walking wherever.
Yeah, and so that's the time you really want to teach patients, know your body. Look at things. If, for example, someone has a health condition that they can't see the bottom of their feet, or they have difficulty doing that, have somebody that once a week checks those things out. Pay attention to those type things. If it gets to the point where it's starting to get red and warm and you're having some signs of infection, by all means get in and be seen. Get on some antibiotics. Get it treated appropriately. Get it cultured so you know what you're dealing with.
Right.
And then
the sooner the better.
The sooner the better, especially if you're prone to having some things go on that does that. And that's, I think, something that people need to do. And
yeah, I wasn't sure if
to this point.
You said that the circulation wasn't good, and if somebody would massage it and keep it going.
It's not going to hurt anything, and everybody could use a good massage. So.
Sure.
That's right. I agree.
Now, one thing I think is really fascinating is that you guys have the hyperbaric oxygen chamber. I know, for example, my uncle had a foot wound, and he was diabetic, and he'd had some osteomyelitis and some other issues, which was the bone infections, and he'd had, so his wounds were severe, and he actually ended up with some amputations of his toes. He had to, it's been several years ago, he had to drive, and he lives in the Rye-Green area, he had to drive to Ashland, Kentucky every single day to KBMC. Wow. To receive treatment for the hyperbaric oxygen chamber, and so that's what essentially healed him. But being off work, driving, I don't even know how many miles would have been round trip, and you're looking at from here, you're looking, down 93 is the fastest way to to Ashland, and so it's extensive and it's time consuming and it's tedious and you're missing work, and so
hyperbaric chamber is you get into this thing and they raise the pressure of the air.
Yes.
And the oxygen level.
Yes, the oxygen is concentrated. It's an example would be a dive. When you're diving into the ocean and you have your tanks on your back, you have pressurized oxygen at that point. It's the same principle that we use. That you're diving, and in fact, we call it, they're going to dive today. So it's the same principle of
What's it like when you're in there?
They say, I've never been in the chambers and received the oxygen, but they say that you can't tell anything that's going on. It's wonderful. A lot of people will watch TV, they'll read a book. Some of them even sleep during their treatment.
So your ears aren't popping and all that?
Well, there is an association of ears popping, such as when you're in an airplane. Sometimes your ears will pop. You can just do a yawn and that will go away. That sensation will go away.
How long is the treatment?
90 minutes.
Okay.
So, and it's about 2 hours from the time that they come and get dressed, because you have to wear cotton and get into the chambers, and then when they get out, and so it's about 2 hours that they spend with us.
Have a nice stereo system in it?
Yeah.
Cool.
I bet they do.
Yes. You can listen to stereo, your favorite channel on the radio, your favorite TV show. We have a TV right over top the chamber, so they can watch whatever they want to watch.
So this is something you can sit in?
You can sit up.
It's not like the old ones I remember you just slide in.
Most people just lay down in them. It's a big long cylinder tube, and it's acrylic on the outside so you can see through. And
do you find that people have trouble that are claustrophobic in this thing? Where it's acrylic, I'm sure that probably helps that, where they can see and they don't feel as closed in. But do you ever have issues with that?
Well, the ones that are claustrophobic, then they don't seem to mind the tube, that they're comfortable because it doesn't feel like that you're in a tube, because it's all clear.
Not like the MRI machines or
CAT scans. It's not the same. It's different because you can see through it, and that makes you more comfortable to see your surroundings.
Is the healing rate, is it 100% with the bariatric or
yes, our healing rate right now is at 100%, and that's one of the
hyperbaric.
That's one of the criteria that got us Center of Distinction for 2016. So that was a very big thing to be honored and given the Center of Distinction Award. We were just recently honored by the state of Ohio. They sent down a big certificate to us for our excellent care in the Wound Care Center in Jackson.
Oh, that's
so we do great work in Jackson, Ohio.
Yes, It's much closer for people than, say, driving to Ashland or
Oh,
Columbus
yeah.
or wherever they may have to go for that
Absolutely.
treatment. It's great that we're having other options for
Yeah.
treatment here close to home.
Yes, yes,
Yeah.
it is. I think it's
Especially
wonderful.
for people trying to work and have families and go to their kids' ball games and do things.
Right,
Oh.
and when you were talking about your dad having to go into hyperbaric therapy, I know that trip too well, going down 93. So that is, you know, him not feeling good in the first place, having that wound, and then traveling down the winding roads of 93. I'm sure he didn't feel good by the time he got there. So
That 93 road would just about do anybody in.
it's nerve-wracking.
Are all wounds on the outside, or do you have internal wounds too that
There
can be
are
treated?
internal wounds as well from people that come to us with radiation wounds that are in the inside, and we just recently had someone go through the chambers with radiation, and we healed them, and they are doing fine now. So I think it's wonderful, the work that we do.
That's amazing. Do you find that most insurance companies pay for this treatment?
Yes. Yes, we work with all insurance companies, from Medicare to Medicaid to commercial insurances, and we always double check before we ever treat anyone. We get that authorization to make sure that their insurance is going to pay. And if there's anything that has to be out of pocket, we discuss that with them, that, hey, this is how much your insurance company is going to pay.
Well, I'm sure as with any other medical treatment, I'm sure you're probably looking at you know, copays, deductibles, things like that,
Yes.
as you would with any service.
Yes.
Yeah.
So it's
Well,
great.
and for insurance companies, it would be kind of crazy for them not to approve it, because, you know, you look at the cost of getting this wound treated and healed in less than a month versus
Yeah,
the
long.
care for long term, and you look at possible, you know, amputations, you know, continual treatment in and out of the hospital, IV antibiotics, admissions, all that stuff. So that's pretty significant.
Yeah, if we can prevent an amputation, that is wonderful, because the statistics based on amputation is short-lived on people that have to get an amputation, and
Because
it's
now
really
you have a bigger
sad.
wound.
It
Yes,
is.
it is.
It is.
So we want to prevent that, and you can prevent that with the
Absolutely.
hyperbarics.
Yeah. You look at the loss of functioning. You know, you see it a lot. People that have had an amputation, they end up having to have a higher amputation if there's not healing appropriately. Say, for example, someone that has a below the knee amputation and they have problems with their stump not healing correctly, and,
Right.
and then it just kind of progresses, and it's a sad situation on the patient end, having to go through that. So, you know, if you can get that wound healed and treated appropriately right from the start,
Yes.
it's a lot better.
Yes.
Now, is there home care options that you guys send out?
We work with the local home health agencies. If the home health agencies see a wound out there that's not healing, then they'll call us and have the patient come to us. So we work with all. We work with home health, we work with the local nursing home facilities. So we are trying to get out there and let people know that we are a viable option. We are a good option for those chronic wounds.
That's good, and you know, and on the medical end, there's not a lot, or in a provider office, you know, you're kind of limited as to what you can do dressing wise and things like that. You know, you can write prescriptions for, you know, appropriate dressing supplies and things, but when you get into a lot of the more in depth, like the things you put into, like,
Yes.
what all
Skin substitutes,
Yes, yes.
and we
The
use
graft, is that what
yes,
it-
we
okay.
use skin grafts and different types of modalities for different types of wounds, like a tunneling wound. We want to be able to pack that correctly and make sure that that wound is still healing from the inside out. And we check that wound every single week to make sure that that patient is getting healed, and we change their bandages and we change the dressing so that they have a clean dressing when they leave, and we let them know this dressing is good for this many days, and then you'll have to come back here and we'll change that dressing, and we may end up having to do some more debridement, whatever it takes to get that wound healed up. Yeah.
It does, and you know, and it's very frustrating for patients as well. I had a patient recently that had an accident and had a wound that completely went almost all the way around his arm, and he was a very, very lucky man. And I had seen him in the office once or twice, and then referred him to you all. And I just ran into him recently here a couple days ago, and I got tickled at him because as he was coming at me, he was taking his jacket off, and he's like, "Look, it all healed," and he was all excited.
Yeah.
And but it was a tough area. It went around the arm and around behind the elbow, And you get someone like that, and they can't extend because
right.
it's not going to stay closed.
It tightens up.
Yeah, and then you get into other things too. If you get skin healing around a joint like that, you have to do a lot of the physical therapy and things to prevent contraction. But it simply wouldn't close because it was in an area, and it was a difficult area.
It tries to close up, and then you pull it apart.
It was a difficult wound, and they did a great job with it. And I was really concerned when I saw him the second time. I'm like, you're going to have to go to the wound care center. I said, this is, and you get into the things too. A lot of people live alone. They don't have someone at home that feels comfortable doing dressing changes. It can be very complex. And you talk about tunneling wounds.
Yes.
And what that means is you may have a surface wound, and then it tunnels back into the tissue. And you don't always know that until you get into these wounds. And like when you're getting into the debridement and stuff, I've seen it a lot. I did ER for years and years, and you'd get it. People would stay at home with these big wounds, and then you take whatever dressing they had on it off, and then you find it's a lot more than you ever had ever anticipated it was.
That's like whenever I look at some of these medical books, it's like, why did they wait so long? There had to have been something before this that was.
And I think a lot of people they don't know. They think it's it's going to get better, or there's just I've seen a lot of different things over the years.
Now I know. I don't know if it's controversial or not, but where you would use maggots to clean out a wound?
Yes, we do not use that therapy in the wound care center, but I have heard of that.
Yeah.
I used to work ER in Lexington at University of Kentucky. I was down there from 2000 to 2003 as an ER nurse before I went to nurse practitioner school. And they actually would do some of that. They would bring in sterile maggots. And I
they
don't
just put you in a box with plies.
No. And at the time I was thinking, it was like 4 o'clock in the morning, and in those big trauma centers with you have people there all the time that are doing all these services. And, they were like, yeah, we're going to do the sterile maggot therapy. And I'm thinking, what do they do, boil them? No, I was just like,
no. We're not cooking them.
No, we're not cooking them. You've been awake for hours and hours, and you've worked long shifts. I'm thinking, how do they get sterile maggots? But of course, they're raised in a sterile atmosphere.
Right.
But it was, it was
I just wonder, I knew that they used that sort of thing on cleaning out things.
Actually, years ago, I had, and I was working ER in Gallipolis back in the mid-'90s, and we had someone come in from a local nursing home that had a wound that had progressed rapidly. And there had been something that a dressing hadn't been changed as it was supposed to be, and they opened it up, and it was full of maggots, and sorry if anybody's eaten it this time. But what that does actually, and it's really kind of grosses the average person out.
Sure.
But you actually end up with a really clean wound because they had done a debridement themselves.
Yeah.
Right.
So hopefully we don't get into that very much, and we'll go on past it.
I know it's an option.
It creeps people out.
Yeah, I know it's an option. I just wanted to see.
And another thing, like I had seen in the past, and it was kind of a bizarre thing I'd never seen before, is they had done leech therapy down there.
Yeah, I've heard of that as well.
Yeah, and that was it was a sterile thing. They had a guy that came in and had been in an altercation, and his nose had been bitten off in a fight.
Oh my.
And they sewed it on in the ear and brought in the sterile leech and applied it to the end of it. And there was a language barrier. He was Spanish speaking, and we had people there all the time that spoke Spanish.
What's the leech supposed to do?
It increased the blood supply to try to save.
I wasn't sure if it was a blood thinning type of a thing.
Yeah, no, but it was rather weird. Okay, sorry, Dina.
That's
we're totally digressing here. But
I'm learning that stuff myself.
It's amazing that the different things. I think the hyperbaric oxygen chamber and things sounds much better than what Mike and I regressed to. But
it's all right.
Yeah, but it's great that this option is here for the community.
Oh, yes.
And are you guys looking at expansion in the future?
Yes, we are looking, and we're talking about hopefully expanding out to Gallipolis area, and I hope that happens real soon. I really do. That would be great because we have patients that come from Gallipolis down to Jackson, and it would be nice for the patient to just have it right there in their hometown in Gallipolis.
That would be wonderful. Would that be located at the Gallipolis campus?
Yes, the Hosier Medical Center in Gallipolis. That's what we're looking at, and talks are being made as we speak today. So
that's wonderful.
Hopefully,
that's wonderful. Would Jackson still remain intact as a facility?
Oh, absolutely. We'd have two different facilities. We'd have here in Jackson and also in Gallipolis. So hopefully we could help people even on the border over in Point Pleasant cross the bridge and come over to Gallipolis and have their wounds taken care of at the Gallipolis campus, and then over to Jackson we can take care of our people there in Jackson, and people come up from as far as you know, south as Ironton or even further south. I would like to see them cross the border from Ashland and come see us.
Great.
Yes.
Well, well, it looks like it's, you know, it's a growing program. There's a great need for it in the community, and it looks like you guys are really paving the way for helping
Yes.
get the patients in our area the care that they need.
I'm doing my best to get them up here.
Well, you're doing a great job with it.
Thank you very much.
But, well, thank you for being a guest with us today. I hope somebody has learned something, and you can call Holzer and ask for their wound care center if you would like to have
Yes.
further information.
Well, thanks for watching.
Thank you.
Thank you.